Next on AM 1480 WLEA, the Newsmaker Show. Here's Bryan O'Neill.
And our first guest is St. James CEO Bryan O'Donovan. Bryan will be with us till 8:30 this morning, and then we'll have Mayor John Buckley at 8:30. Welcoming now St. James CEO Bryan O'Donovan. Thank you for coming up.
Thank you for having me.
The new hospital building, that's going to be the big focus today on the show. March 17th will be the first. How's that going to work out, the transition?
Sure. So there's a lot going on. We've been planning for this for the past 18 months in terms of the logistical, move management, that type of thing, all the operational aspects of it. So at 7:59 a.m., and this is before our outpatient programs will open, we will close the hospital at 411 Canisteo Street. We will open the emergency department and start transferring patients over to our new hospital. And so the way it works with our emergency department, and this is a question I get very often, is that we're contracting with the city of Hornell for 2 weeks to have an ambulance outside of the emergency department at 411 Canisteo Street. This is a requirement that we have worked through the Department of Health based on our closure plan that we were required to submit to the Department of Health. So there will be 24/7 ambulance stationed out with EMTs in front of 411 Canisteo Street for 2 weeks, just in case any patients do present to the emergency department.
So this is very well planned. If I could, and maybe this is jumping a little ahead, but a lot of people are interested. The plans on what to do with Canisteo Street St. James building once that becomes the quote-unquote old hospital building.
Sure, it's a great question. So as of April 30th, right now, we are cleaning out 411 Canisteo Street. There's some things that we cannot do until we move the hospital. We plan on turning over the keys on April 30th to Trinity Health. We have been renting the hospital since my tenure. I've been here about around 20 months now. We pay rent every single month to Trinity. They own the property and the campus, and so we'll be turning over our keys on April 30th to Trinity Health. There have been conversations I've been involved in, as well as the city has been involved in, with Trinity Health over the past year or so, discussing, what is going to happen with the building. Certainly we, myself, Mayor Buckley, and Sean Hogan have had the conversations of the importance, of that property and doing something with it so it's beneficial to the city.
Interested, Bryan O'Donovan, how was the move handled as far as getting all that, in some cases, very large hospital equipment from Canisteo Street up into the new location up in the North Hornell area?
So very carefully. So every single program that we have has a multi-page execution document with move management. We also consult with Vargas Associates, who is planning all of our moves and logistics. In terms of large equipment, we really don't have a lot of large equipment to move. A lot of the FF&E, the furniture, as well as the inpatient beds and the ED beds, we're leaving that and we're actually donating that. The hospital, for the most part, is all brand new equipment. So if we talk about our CT, we'll have a brand new fixed MRI, as well as X-ray equipment, ultrasound, and rad fluoro, and all of that is brand new. Same with all of the beds, the telemetry machine as well, on the inpatient unit as well as the ED. So really, the hospital, part of our budget was purchasing new clinical equipment, as well as furniture and that type of thing. So our number one objective really is to, once we move out, is to start getting this furniture, and we have a company we've been contracting with to, we're donating the furniture to the company, and then they're going to, some of it will go to third world, such as some of the beds and that type of thing. Other things will simply just be destroyed because they are well past end of asset life.
The construction company that built the new St. James, and this is no secret because the people drive by and see it, they seem to move very quickly in getting the new hospital built.
LeChase Construction, so I've worked with them in the past when I was at the U of R. Absolute professionals. We've had such a great relationship with LeChase. The quality of work is exceptional. We actually had our Department of Health survey on Tuesday, which is a requirement to open a new hospital. Very minor findings, nothing significant. We received the green light to open the hospital on March 17th. So another major milestone for St. James, and kudos to all of our partners that have been working with us for with St. James for the past 3 or 4 years on this project.
Talking to St. James Hospital CEO Bryan O'Donovan. Something that's coming up in the news in the past few days. Governor Andrew Cuomo put out, I guess I would almost call it an alert type of message in the news, saying that the DSRIP funding was going to be cut by President Donald Trump. Now, this is the DSRIP. I don't know what that stands for. I'm sure you do, but what it does for our listeners is funds New York State health care by federal tax dollars. And the governor was very concerned about that. Well, I believe it was 2 days ago he put out a statement listing all the hospitals that were going to be facing cuts. St. James was not one of the hospitals listed that was going to be facing any cuts. Do you have any updates there?
I do. So DSRIP is a delivery system reimbursement incentive program. It came online about 5 years ago. Initially, it was supposed to be 5 years, no extension. This program, or the end of this program, will impact St. James. We're quantitatively looking at that now to see the extent. DSRIP really is a Medicaid program to ultimately save dollars from the federal government down to the state level. And, we have certain positions that are funded through DSRIP dollars. So we are very actively looking at that and understanding, what is the potential financial impact at St. James.
Okay. Well, that was good. I was very relieved to see the governor's statement there that listed all the hospitals, and glad to see St. James was not on it.
There will be an impact from a DSRIP standpoint, because the majority of the hospitals, not-for-profit hospitals, do have Medicaid patients, so there is going to be an impact on the majority of the hospitals. I know, especially within the University of Rochester system.
Okay. St. James CEO Bryan O'Donovan, our guest today. We're going to take a quick break. When we come back, we'll talk a little bit about coronavirus preparedness and the latest on that issue. Stay with us.
Dad, I need to get my corporate taxes done. Can you take me to Cunningham Starring & Associates?
Corporate taxes? You have a corporation?
Yes, I opened it to get checks for my YouTube channel.
YouTube channel?
Yes, I have a YouTube channel. Now can you take me to Cunningham Starring & Associates? They are due on March 16th, and my personal return is due on April 15th.
Take you where?
To Cunningham Starring & Associates at 91 Washington Street in Hornell, on the corner of Thatcher and Washington Street, or find them online at hornelltax.com.
It's a President's Day event at Maple City Dodge. Well-qualified buyers can lease a 2020 Jeep Cherokee Latitude Plus with heated seats, heated steering wheel, remote start for $299 a month. That's a Latitude with an MSRP of $31,580 for 39 months with 10,000 miles per year with $3,000 plus your first payment down. Tax title tags extra. Similar offers on other Jeeps available. And get up to $6,000 off MSRP on all new leftover 2018 Jeep Wranglers in stock. Visit Maple City Dodge in Hornell, where you get the real deal every time.
The Alzheimer's Association offers free expert information, support groups, and education programs. Caring for someone with Alzheimer's or dementia isn't easy. Reaching the Alzheimer's Association is. To learn more, go to alz.org. That's alz.org.
Back on this special one-hour Newsmaker show with St. James CEO Bryan O'Donovan. We're going to get off topic just a little bit and talk about coronavirus preparedness. We read in our news this morning, the New York Times reported at 5 a.m. that there are no confirmed cases in New York State. Before we went on the air, we talked a little bit about that. You said something about Rochester. That's also true for Rochester.
As far as I know that the governor has allocated, I believe, $40 million to make sure the preparedness is in place in case coronavirus does eventually reach New York State. We are working very closely with our colleagues at the University of Rochester Medical Center, and continuously keeping in contact with them as well as other government officials in our local areas.
Bryan O'Donovan, the recruitment for doctors, and back to that topic at the New St. James. How's that been going? And is this recruitment for the New St. James or the entire medical community as well?
So recruitment really started about when I got here. We really started working very closely with the university. To date, we've hired 18 new physicians in a multitude of different specialties. The feedback that we have received has really been absolutely extraordinary. Very quality, solid physicians, excellent patient care, as well as interpersonal skills. We have recently recruited 4 new physicians. 2 of them will start they're from the University of Rochester, all of them. Will start in our emergency department in April, and then a third will start in July of this year. So that's certainly a great addition to Dr. John Robshaw, who's our ED medical director, as well as overall for the emergency department. We've also recruited a neurosurgery pain management physician, Dr. Gabriel Jakob, who will be starting in April. And then we also have a new ear, nose, and throat physician who will be starting in April or early May. And so I look at the culmination, the collectivity of the physicians as well as our current medical staff, and really feel we've been very fortunate to continue to add services, needed services to the Hornell community and to our patients.
Now, the new doctors we were just talking about, will some of them or all of them be up at what you guys call the MOB, the new medical office building there in North Hornell near the new hospital?
Yes, so the ENT physician as well as our pain management physician will both be seeing patients in our specialty suite at the medical office building. Obviously, the ED physicians will be solely specific to the emergency department. And one thing that we're really looking forward to, not only our patients that I've talked to, our staff, but our medical staff. And I'll give general surgery as a great example of, they have clinic at the medical office building. Right now they're driving back and forth to 411 Canisteo Street, and they'll be able to walk across the sidewalk into the hospital and be able to be a little bit more available to consult on patients than we have been in the past, just because of the proximity and geography. So I think that's something that all of us are looking forward to, is having all of our programs on one campus.
March 6th at 1 p.m., the new hospital open house. What can you tell us about that?
Yeah, so really excited. We wanted to open up this new hospital to our community members. It's very similar to what we did with the medical office building. I think it's really important. We built this hospital for the community, and I really want the community to come in, have an opportunity to look at the new facility, new hospital, talk to some of our staff, some of our physicians, and answer some questions that they may have. But really, it's just the opportunity to come in and look at what we've been building the past 2 years, and so they can see for themselves and have the opportunity to walk around the facility before we fill it with our patients. So I really, extend the invitation out to the community. I would love to be able to welcome the community as they walk through the doors and answer any questions. But I will tell you, I'm up there a couple of times a week, and what an amazing facility. I've been in healthcare 15 years. I've done millions and millions of dollars of renovations. I've never seen anything like this. I've never been a part of a new hospital, building it for patient-centric care from the ground all the way up. And this really is 130 years the last time a new hospital opened. This is really history in the making, and very excited. My team, medical staff, we're just so excited to be a part of this.
I know that, I'm sure that a lot of people have been inside the medical office building. You just have to drive by and see all the cars parked up there. Wondering, Bryan O'Donovan, what about the new hospital building in terms of non-employees? Has anyone had any reason to go in there, maybe for an appointment or something? I don't know. People outside the hospital loop and people outside the, Hornell officials who are getting tours and whatnot?
Sure. Not really. From the DOH, Department of Health, we need to, and this is why we have covered up our signs specific to emergency, and this is something we're very cognizant of if there are out-of-towners that are driving by and we have emergency signs up, the last thing that we want is somebody that's in dire need of an emergency to show up to a hospital that's not occupied yet. We have had all of the EMS folks, the city folks as well, North Hornell, Hornellsville, and the city of Hornell walk through for fire safety reasons and that type of thing. Our donors, we've had a capital campaign going for the past year. All of our donors have been through looking at the new facility. But other than that, this is really the first opportunity to be able to have the community come in and check this new hospital out. And that's really why I'm hoping that we have a wonderful turnout on March 6th at 1 p.m.
I'm on the University of Rochester's website, and I'm on the new hospital construction page. They talk a lot about they being people in medicine, and I know Dr. Annabelle and Dr. Collins, the late Dr. Collins, and the different doctors we had over the years would talk about the changes in medicine. And they would talk about how it's getting more, I guess they would use the phrase community-based, or maybe for the listeners it would help outside the hospital. Tell us about that.
Yeah, so I think preventive health, over the past 10 years, 5 to 10 years, a major shift in healthcare has been providing it in the outpatient environment. And so I can tell you, for St. James, we're really at a 70% outpatient in terms of overall volume and 30% inpatient. And the goal, healthcare has evolved in terms of looking at what can we do to prevent hospitalization in terms of diet, in terms of physical therapy being available in the outpatient environment, and all of these specialists. And so you go to the medical office building, you can go into our specialty clinic, you can be seen by 7 different specialists, and then you also go through with an urgent care center to be able to treat some of these respiratory and severe cold and stomach and that type of thing without having to go into the hospital. And certainly that's the future, is preventative health, and we're seeing that now. Our volumes of the medical office building have significantly grown, but another really important piece of this is primary care. And Doctors Ashdown, Dr. Peterson, as well as Dr. Nazareth, and all of our fantastic providers in our primary care, they're seeing these patients and they're providing the much needed services before these patients ever get to the point where they need a hospitalization. And so that's really where we are in the continuum of healthcare, is a major focus on outpatient, and that's going to continue.
I continue to stay on this website and I list off, and you probably have said some of this already, so forgive me if I'm repeating anything. The new hospital, 15 inpatient beds, emergency department with 8 treatment rooms and 4 observation rooms, a surgical suite with 2 operating rooms, 2 procedure rooms, 15 pre- and post-surgery rooms, cardiac rehabilitation, phlebotomy, and lab. I see the number 15 coming up twice there, 15 rooms for pre- and post-surgery and 15 inpatient beds. Curious, how did you come up with the number 15?
So I believe this is a little bit before my time. I believe they looked at the volume, the emergency department volume, and there's a quantitative analysis that you can do in terms of room turns and that type of thing. And then from an inpatient standpoint, you can look at the overall discharges year to year, and then you can basically do the mathematic formula that comes out to X amount of beds. But, the calculation was certainly done before me, so I'm not sure everything, all the data that went into it.
Sure.
What I do want to clarify is we actually have 4 operating rooms.
Okay.
The other thing, from a phlebotomy station, we do not have a phlebotomy station in the new hospital. It is right next door, 100 yards away in our medical office building.
Oh, sorry about that.
That's okay.
And the website also talks about the medical office building. What kind of reaction are you getting from the doctors and the nurses about both the new medical office building and the new hospital?
So I can tell you, over the last, I'd say 4 or 5 months, I mentioned the importance on recruitment and how fortunate we've been. For some of these surgeons, I simply have to walk them into the OR and they're sold. The reason I say that is these ORs are 625 square feet. That is a significant amount of square footage that they have not seen previously. I come from a background in heart transplant at Strong, and some of those ORs were that big. But when you add a surgeon for orthopedics, general surgery, and some of these other things, and also the equipment, all of the clinical equipment in the ORs are interfaced together. So you have the anesthesia machine talking to the booms talking to the EMR. It's really quite state-of-the-art, and that's something that the new physicians, the new surgeons that are coming out of fellowships, this is something that they're already used to. And so for them to step into even a rural community, but to have a state-of-the-art hospital, I think that's something that I've heard just tremendous feedback about. I've also walked through many of the University of Rochester chairs who have been blown away by the technology and the services that are available. The imaging equipment that we have is all brand new from Philips, and that's certainly something that I've been part of multiple projects at Strong, and this imaging equipment that we have is actually newer than some of theirs. Now that may change in 6 months or a year, but as of today, we have the latest imaging equipment in MRI and CT and other.
The funding for this for all this new equipment, was that part of the funding that I believe the state came up with, or some of this federal too? How's that work?
Yes, it was. So as part of the $64 million, you look at there's a calculation and budget allocation for each, such as IT, physical plant, and then you look at the clinical equipment, and obviously the clinical equipment, it could be 5 to 10% of the overall budget. MRIs are $1.5 million. This is very expensive equipment. So there have been line items for each that certainly, that we have obviously been tracking throughout the life of this project from a budgetary standpoint.
Bryan and Donovan, I hear all the planning and every possibility thought out from what time exactly, the time, and not just the hour, but the minute that the ambulances and the fire departments and the police will know, the emergency responders will know when to go to the new hospital in the North Hornell area versus taking them to the what we call the old hospital, Canisteo Street area. Wondering, who came up with all the planning for this? Was this done by committees? Did the U of R weigh in? I'm sure you had a lot of experience with your previous hospital experience.
All of the above. So all of the above. We have multiple committees on Friday, for example, from 8 to 5 o'clock. These are all move management committees, and behind every move management, every single program, there is an action plan behind that, almost detailed to the minute on exactly how this is going to go. Now, this is healthcare. We know this is not going to go minute by minute, so certainly we have a plan B, C, and D. But there has been extensive planning for this, and we have absolutely pulled in the university and colleagues that I've worked with in the past that have experience doing this. So we've used, and we've also used the local. The city of Frank Brzezowski has been absolutely fantastic, as well as other local EMS and fire and police to be able to sit down and provide their insight onto some of the challenges that they see could be happening.
So let's go over these dates again with St. James CEO Bryan O'Donovan. March 6th at 1 p.m., the new hospital open house, and then March 17th, the first day the building will be open, the new hospital building up in North Hornell.
That's correct. So 8 a.m. We will be opening. We do have a comprehensive marketing insertion strategy. We've already been putting that out, digital, social, as well as print. So we're doing everything that we can to notify the community on all of these changes. We also have posters that are in our ED and throughout our hospital, as well as our medical office building, of when it will close. We will leave a couple of staff members from the emergency department behind for a few hours, March 17th in the morning. But again, we're partnering with Mayor Buckley, the City of Hornell, so we'll have an ambulance and EMS crew for 2 weeks outside of our emergency department.
With that, we have to leave it. St. James CEO Bryan O'Donovan, thank you for joining us.
Thank you for having us.